There are several different things that cause dry eye. I always talk about it like it's an umbrella. You have the main umbrella of dry eye, and you have tear film insufficiency, and you have meibomian gland dysfunction. Tear film insufficiency, basically you're not making enough tears. And that happens as we get a little older. You're wearing contact lenses, you're post-surgical, LASIK, or even cataract surgery. Sometimes you're just not producing enough tears. That's tear film insufficiency. And then meibomian gland dysfunction is where the glands, they're just not working like they used to. And that is also part of the aging process. So once we can get those glands working again, that will solve the meibomian gland dysfunction. But sometimes both of those go hand in hand, so we actually have to treat both of them. Everybody comes in saying, I've been using Visine, it's not helping. It's got a vasoconstrictor in there, and it just chokes off the blood vessels. So it does get rid of the redness. It chokes off the vessels, but those vessels are trying to get stuff to the eye. It's trying to get nutrients to the eye. So I always tell patients, it's like there's a fire going on and you just cut a tree down in front of the street, you're blocking the fire trucks. Preservative-free artificial tears, that's the new thing, because when you have a bottle of tears, we have to put preservatives in there to keep bacteria from growing in the bottle. It hurts the eyes a little bit. Those preservatives are not good for the eye. So now we have the preservative-free artificial tears, which I recommend that almost for anybody who needs it. Gonna put anything in your eye, make sure it's preservative-free artificial tears. So a couple years ago, we stumbled upon this new treatment, talked to some of my colleagues about it, and it just was great results with the patients. So we've been slowly building the program over time. The actual procedure we do, the main one we use is called the ClearLids Program, where we go in and we heat up the gland to express all the old caked in oils out of there. And once we get the oils out, we're kind of working with a fresh new lid. We go in there, we heat it up, we clean it out, extract anything that might be stuck in there. You know, it's pretty much pain-free. After we get it all cleaned out, we do some scrubbing, and then we have an eye massager. It's a hot, cold massager. Everybody loves that part. That's like the last 10 minutes of the procedure. They all love that. The normal ClearLids program is normally a 3-month program. We do it 1 month, 2 month, 3 month. We send you home with product, so you get all the warm compresses, the lid scrubs, the omega-3s, and some lubricating drops that you're doing at home. So it's kind of like when you have your teeth cleaned, you got to take home the brushing and the flossing. We send you home with all the stuff you need there. A lot of people come in not knowing that the redness, eyes are they're tired, they're beat up. So a lot of that can be fixed with just fixing the glands. You fix the glands, you get everything moisturized, the redness goes away, the irritation, the itching, all that goes away. But I also get a lot of questions about the bags under the eyes, the wrinkles over here, and there are things with our advanced dry eye program. We use red light therapy. So we do all the things in the ClearLids program to get those glands functioning again. But we also use red light therapy and serums along the eyelids to kind of open that up and get those fixed up.